Alright, my name is Marissa and this is my video for doing NG insertion. So the first thing I'm going to do is I'm going to check my chart, and my patient here is Jennifer Doe. She has no known allergies and she has an order to have NG placement due to her small bowel obstruction. So I'm going to go ahead and gather my supplies right away. And the supplies that I have are gloves, my NG tube, tape measure, my lubricant for my NG, some hand sanitizer, my tape which I already pre-set up here, a safety pin, my pen light, tongue depressor, shirt prep or skin prep, and then I have stuff over here for the patient when I'm placing it for an emesis basin, a pad to be placed in her chest, some Kleenexes, and something to drink. If my patient was NPO, I would not use the water, but in this case I will offer it. So then I'm going to go ahead and I'm going to go wash my hands outside of the room. And then I'm going to knock, provide for privacy. Hi Jennifer, my name is Marissa and I'm a student nurse and I'm going to be placing an NG today. Can you please tell me your name and date of birth? And she says her name is Jennifer Doe, date of birth is 11/5/1975, and I have that matching up on here. Jennifer, I have that you have no known allergies. Do you have any allergies that we know about or don't know about? We're going to be using some shirt prep on your nose. You don't know if you have any allergies to that? And she says nope. So, okay, well then I'm going to go ahead and I'm going to assess for which nair placement I should have. Oh, and I'm going to put your head of bed up right away here in high followers position. I also have my suctioning set up right away. Right now it's on regular low suctioning just to make sure that it is working properly. If my patient would need suctioning, I would do whatever the order calls for, which would probably be low intermittent. So I'm going to go ahead and I'm going to check for my nair placement or what one I should be using. So I'm going to go ahead and push down on one side and have Jennifer, can you take a breath in your nose and do your other one? Alright, is there a nose or a nair that you're getting more airflow in? And she says her right side, so I'm going to go ahead and I'm going to insert the NG in the right side there. So before I start, I'm going to apply, well, I'll put my gloves on for that first, but I'm going to go ahead and check my gag reflex. And she's good, she's got a gag reflex. So I'm going to go ahead and I'm going to put my gloves on here. I'm going to put my shirt prep on her nose. Alright, and then I would throw those away. And then Jennifer, I'm just going to put a pad here while we do the NG insertion. Also, here's an emesis bin if you would need to use it at all with some Kleenexes. Alright, and I'm going to go ahead and measure. So I'm going to measure from the ear to the nair, and then from the nair to the xiphoid process. Right there. And I'm going to put tape on here. And that's just to mark my placement or how far I should be placing this NG tube. So then I'm going to go ahead and I'm going to get my lubricant here. Alright. Jennifer, I'm going to have you go ahead and hyperextend your neck, and I would have her put her head back for me. And I'm going to go in at the bottom part of her nair. And then once I reach the oral pharynx, I would have her tip her head down. And I would be inserting, and I'd have her swallow. And then I'd insert 5 to 10 centimeters every time she swallows. Also, this could be a time that I could offer her water to help her swallow to get the tubing down. If I have any resistance, I would pull back and try to go again. However, I wouldn't keep trying to push if I was hitting so much resistance because I wouldn't want to cause any damage. And then once I'm up to my tape mark, I'm going to put my other tape on the bridge of her nose here to hold it in place. once I have it taped on her nose there, I'm going to go ahead and I'm going to measure this right away. And this is just to measure for placement so that I can document this, and this is a way for other nurses to check for placement later on. There. So I've got about 28 inches. Make sure that tape sticks on there. So 28 inches, so I would again note that down so that I have a baseline of how far her NG is placed. And then I'm going to take this tape here with my safety pin and I'm going to pin it to her gown, and this is just to help keep it up. Just going to pin this on you, Jennifer. And then I'm going to remove my supplies here, throw this away. And then I'm going to remove my gloves. And then I'm going to take Jennifer to x-ray or call x-ray or whatever is needed to check for placement. That's usually what facilities call for, is having an x-ray done. Otherwise, I will, I can check it with a pH strip, or I can use a syringe and check for gastric content. Once we're back in the room, I would put Jennifer in her safeties. I would lower the bed. I would give her her call light. And then once placement is checked, that's when I would be able to do suctioning if it is ordered, or give a medication or feeding. Again, I wouldn't do that until the placement is confirmed. And then a lifespan modification would be whether they were a smaller patient, not just a child, but a smaller patient in general, I might use a smaller tube. Other than that, I would wash my hands before leaving the room, which all my supplies would be disposed of. I would wash my hands, and then I would document, and what I would document is the size of the tube, that it was confirmed by x-ray, obviously the date and time that I did it, and how the patient tolerated it.